The digital system, the digitization process of SHA is what is making us to detect all the fraudulent claims, all the ghost hospitals, and all the fake patients that are attempting to carry out fraud.
SHA is not a reform. SHA is a grand calculated scam.
President William Ruto is fighting back. Standing before grassroots leaders at State House, he dismissed claims that billions of shillings from the Social Health Authority are being funneled into ghost hospitals. Yet outside the gates of power, a chorus led by Nairobi Senator Edwin Sifuna, as well as Kenyans, is saying something very different. That what Ruto calls digitization is actually multi-billion scam.
Tunataka afya iwe haki ya kila Mkenya.
The stakes? The very future of Kenya's healthcare and perhaps the president's political credibility.
Nyinyi mnanielewa?
Ruto's message was uncompromising. The SHA system is designed to stop theft and not enable it. We will never see the kind of fraud that buried NHIF in 30 billion Kenyan shillings debt. SHA will expose ghost hospitals, ghost patients, and ghost claims. He pointed to digitization safeguards and revealed that close to 1,000 suspicious facilities have already been shut down. Anyone caught stealing, he warned, will refund the money and face prosecution. But while Ruto insists the system is airtight, public confidence was rattled after revelations that Nyandiwa Dispensary in Homa Bay, an abandoned facility among others, was allocated 20 million Kenyan shillings. Officials called it a clerical error. Kenyans called it fraud, and the opposition seized the moment.
Ile wizi iliangusha NHIF mpaka kukuwa na madeni ya bilioni 30. Haiwezi kufanyika ndani ya SHA. We will make sure the digital system, the digitization process of SHA is what is making us to detect all the fraudulent claims, all the ghost hospitals, and all the fake patients that are attempting to carry out fraud in our health sector. And I want to promise the people of Kenya, we have already closed close to 1,000 health facilities. We are not going to stop at closing the facilities. We are also going to make sure that they refund the money if ever they have been paid. And thirdly, we are going to prosecute them because it is criminal to steal money meant for patients. It is criminal to steal public resources using whatever means. So, watch this space. SHA is going to work because we are going to eliminate fraud. Nyinyi mnanielewa?
From Parliament, Sifuna and fellow Moja MPs Obadia Barongo, Clive Gisairo, Tony Kibageni and Wilbur Oundo dropped political dynamite. This isn't reform, it is theft in broad daylight, Sifuna declared. According to them, SHA isn't a healthcare solution but a deliberately structured pipeline for looting. Their biggest charge? That SHA's procurement cost 104 billion Kenyan shillings, when upgrading NHIF would have cost just 700 million Kenyan shillings. By the math, that's over 103 billion Kenyan shillings unaccounted for.
From the very beginning, we raised serious concerns regarding the establishment of the Social Health Authority, SHA. We warned about the rushed implementation, the lack of transparency in acquisition of the system, the extreme questionable financial decisions surrounding the program. We questioned why government chose to purchase a system costing 104 billion, a system with no clear state ownership, when in fact upgrading the system from what we had in NHIF would cost the taxpayers about 700 million today. The reason behind the rush is clear.
They further alleged Health CS Aden Duale is linked to the vendor behind SHA. A State House advisor is connected to a company authorized to collect revenue and make payments for SHA. SHA Chair Abdi is tied to Aden Hospital, which reportedly pocketed 66 million Kenyan shillings.
We have uncovered evidence of deep-rooted conflicts of interest. The Cabinet Secretary Health is reportedly associated with the same company that developed the SHA system. As you may be aware, there is reason for us to bring this up because the CS for Health is associated with Convergence, one of the companies in the consortium, and there is an advisor in State House who is associated with Apiero, the two companies that government has outsourced the approvals and payment of claims to. The company, a company in charge of revenue collection and payments. Further, the chairman of SHA has links to Aden Hospital, which has already received 66 million shillings under this scheme. Payments under SHA are skewed and discriminatory. Some providers are consistently paid, while others offering genuine health services have never received a cent. Worse still,
while ghost facilities collect payouts, real hospitals are collapsing. St. Mary's Hospital in Mumias shut its doors after SHA allegedly withheld 180 million Kenyan shillings owed. Patients were turned away, workers sent home. Meanwhile, ghost hospitals like Aden continued to cash checks.
Ghost facilities, as you may have seen, are being paid regularly. Let us give you some examples. And in some of these examples, you'll realize there is an astronomical increase in the number of facilities, particularly in the northeastern region. When we had NHIF, we had 153 facilities accredited by NHIF across the northeastern region. However, with the coming in of SHA, we have close to 700 facilities that have been accredited in the past few months, and it is equally discriminatory. They have reduced the number of accredited facilities across particularly Western region, Nyanza region, so that they can increase the numbers in areas they wanted to unleash this scheme. Nyandiwa dispensary, for example, which has been closed for some time, continues to receive payments. Divine Sparkle Medical Center in Rangwe, Homa Bay County, received 2.8 million in June, yet it does not even exist. In northeastern and Mandera, the number of, like I've said, accredited facilities has increased. Recently, hospitals are the biggest beneficiaries. Hospitals that have been there for a long time don't seem to be receiving the amounts that are paid by SHA. New facilities registered in 25 in the year 2024 are the ones that receive these funds regularly. Wante Nursing Home Limited, registered on 12th of February 2025, applied to the Ministry of Health the very next day and was approved the same day. It has no physical location. Yet, by April, it had received 3.8 million shillings. And that is why the ministry quickly brought down their website so that you and the rest of Kenyans don't get to see what is going on there. Sipili Maternity and Nursing Hospital, which was shut down 3 years ago after an expose by the NTV revealed sexual harassment by its owner, has received close to 5 million shillings. Who is running this facility? Does it even have a license? And who actually licensed it?
Will SHA be remembered as Kenya's digital cure to health fraud or as the biggest healthcare heist in the nation's history? One thing is clear, ghost hospitals are cashing in, real hospitals are dying, and the truth will decide whether Ruto's legacy survives this storm. What do you think about this saga? Drop your comments. Newsroom, Maisha TV, Bushabi Jr.